Many of us eat frequently during our workday, on breaks, at lunch, or just snacking, and often we wolf down our food. You may not realize it, but a victim of choking can die within minutes from lack of oxygen.
Is that a scream? Oh my God, my head's held.
If you see someone choking, yell for help, then perform the Heimlich maneuver. This is designed to force air out of the victim's lungs and dislodge the object that is blocking their airway. Start by making a fist, your thumb on top. Put your thumb just below the victim's rib cage. Grab onto your fist with the other hand and make short thrusts in and up into the victim's abdomen. Squeeze only with your forearms and hands. Applying pressure with your upper arms could crack the person's ribs. Keep going until the object comes loose and the person can breathe again. If for any reason the person stops breathing, have someone phone emergency medical services immediately. You should keep their number posted for quick access. If you are trained in rescue breathing, also called artificial respiration, start the process immediately. If you aren't, you should know who in your facility is and get them. Work on the victim until they start breathing again or until emergency personnel arrive. Remember that if someone stops breathing for just 4 to 6 minutes, the odds of brain damage or death are very high. As we get older, we become more vulnerable to heart disease, and our chances of having a heart attack go up. If someone has a heart attack or a sudden cardiac arrest, that's when the heart can stop cold. Quick treatment can be the key to their survival. So it's important to recognize the symptoms quickly.
Just relax.
A heart attack victim may suddenly have trouble breathing, feel a tightening in the chest, and experience nausea or indigestion. Their skin may turn pale or blue and go cold and sweaty. If you see someone exhibiting these symptoms, call emergency medical services immediately. There's no time to lose.
Yeah, I got a guy showing symptoms of a heart attack.
If the victim is conscious, help them to a sitting position. Use pillows or something similar for support. Keep them warm and comfortable and loosen their clothing, especially shirt collars. Ask if they're on any heart medication and if you can get it for them. If the victim is unable to speak, check for a medical ID bracelet or look for an emergency medical card. If their breathing stops, but they show a pulse, and if you're trained in rescue breathing, start the process. If the person's pulse is erratic or they have no pulse at all, they may be in sudden cardiac arrest and in danger of dying. That's where AEDs, automated external defibrillators, and CPR come in. There are 220,000 occurrences of sudden cardiac arrest each year, about 10,000 of them on the job. Studies show that if a victim has to wait for emergency medical personnel to arrive before they are treated, there is only a 5 to 7% survival rate. However, with immediate treatment, called defibrillation, up to 60% of cardiac arrest victims can survive. Sudden cardiac arrest occurs when the heart's normal rhythm is interrupted or it stops beating altogether. Causes include heart attack, electrocution, and asphyxiation. If you are trained in using an AED and one is readily available, in these situations you can literally save a life. AEDs are designed to analyze the heart's rhythm and deliver an electric shock to restore it to normal. Most AEDs use voice prompts to help rescuers.
Check circulation.
Once the machine is turned on, the rescuer will be told to apply the 2 electrodes to the victim's chest.
Attach electrode pads.
The AED will then begin to monitor the victim's heart rhythm.
Analyzing.
If a shockable rhythm is detected or if the heart has stopped completely, the machine will charge itself. Then instruct the rescuer to stand clear and press the treatment button.
Touch patient. Press treatment button. Treatment delivered.
Once the victim's heartbeat has been restored, they should be kept comfortable until emergency medical personnel arrive. If there is no AED available and you are trained in CPR, start the process immediately. Keep it up until the victim starts breathing or help arrives. There are 2 forms of CPR that are now approved by the American Heart Association. The traditional method has been to alternate 30 pushes on the chest with 2 quick breaths into the victim's mouth. This should still be used with children as well as adults who may be suffering from a lack of oxygen due to a near drowning, drug overdose, or carbon monoxide poisoning. The newer approach eliminates the breathing and uses rapid, uninterrupted chest compressions at the rate of 100 per minute. This is effective with most occurrences of cardiac arrest, where the victim still has an ample supply of air in the lungs and blood. Whichever method you use, it should be continued until paramedics take over, an AED is located, or the victim resumes breathing. We've covered a lot of ground on a very important topic. So, let's review. Learn to think and act quickly in case of an injury. Know the location of first aid kits and AEDs in your area. Learn to recognize symptoms like those for shock, heat stress, and a heart attack. Know when it's okay to move a victim, as well as when it's not. Know when medical attention is called for and how to get it. And one last point, try your best to find the time to take a first aid course, because what you learn could save a life.